Early warning signs of blood cancer you should never ignore. Today, we're diving into a topic that could save lives: recognizing the early warning signs of blood cancer. I know the word cancer can be terrifying, but what's even scarier? Not knowing the signs until it's too late. Blood cancer is often called a silent killer because it affects thousands of people worldwide every year. Yet many don't realize they have it until the disease has progressed. The reason? The symptoms can be incredibly subtle: fatigue, unexplained bruising, or night sweats. These are things most people would brush off, but ignoring them could be a life-threatening mistake. The good news? Early detection saves lives. The sooner you recognize the symptoms, the better your chances of effective treatment and survival. So today, we're breaking down the most critical warning signs you should never ignore. Let's jump right in. Symptom number 1: swollen, painless lymph nodes. One of the earliest red flags for blood cancer is swollen lymph nodes, especially when they don't hurt. Lymph nodes are part of your immune system, acting like filters to fight infections. Normally, they swell when your body is battling a cold or infection. But when it comes to blood cancers like leukemia and lymphoma, something more serious is at play. Instead of fighting germs, the lymph nodes swell due to an accumulation of abnormal white blood cells, which disrupts their normal function. The key thing to watch for? Persistent swelling in the neck, armpits, or groin that doesn't go away after a few weeks. Unlike infection-related swelling, these lymph nodes are usually painless and don't shrink over time. A 2018 study published in the Journal of Clinical and Experimental Hematopathology found that lymph nodes that stay swollen for more than 2 weeks without signs of infection should be checked by a doctor immediately. While swollen lymph nodes don't always mean cancer, early detection is critical. If you notice this symptom, don't wait, schedule a checkup right away. Symptom number 2: shortness of breath. Most people associate shortness of breath with asthma or heart problems, but did you know it can also be a warning sign of blood cancer? Cancers like leukemia, lymphoma, and multiple myeloma affect the body's ability to produce healthy red blood cells, leading to anemia. Anemia means there aren't enough red blood cells to carry oxygen through your body, which can leave you constantly out of breath, even during simple activities like walking up the stairs. In some cases, an enlarged spleen, a common complication of blood cancer, can press against the lungs, making breathing even more difficult. Some blood cancers also cause cancerous cells to invade lung tissue, leading to persistent breathlessness and a tight, constricted feeling in the chest. A 2023 study published in BMC Cancer found that 44% of blood cancer patients reported experiencing respiratory symptoms, including shortness of breath, at the time of their diagnosis. If you find yourself frequently gasping for air, don't ignore it. A simple blood test and imaging scan can help determine if something more serious is affecting your oxygen levels. The sooner you get checked, the better your chances of early detection and successful treatment. Symptom number 3: persistent weakness and fatigue. We all get tired from time to time, but unrelenting fatigue that doesn't improve with rest can be a serious warning sign of blood cancer. This isn't just feeling a little exhausted, it's a deep, overwhelming lack of energy that disrupts daily life. Blood cancers interfere with the body's ability to produce healthy red blood cells, which are responsible for delivering oxygen to tissues and organs. When there aren't enough red blood cells, your body struggles to function, leaving you feeling drained, weak, and exhausted even after a full night's sleep. Simple tasks like walking up the stairs, running errands, or even getting out of bed can start to feel incredibly difficult. According to a 2023 study published in Scientific Reports, 40% of blood cancer patients reported experiencing unexplained, severe fatigue before their diagnosis. This isn't the kind of tiredness that goes away with rest, it's something much deeper. Symptom number 3, persistent weakness and fatigue, feeling constantly drained, no matter how much rest you get. Extreme fatigue can be an early warning sign of blood cancer. Unlike normal tiredness, this kind of exhaustion is deep, persistent, and doesn't go away with sleep. Blood cancers interfere with the production of healthy red blood cells, which are responsible for carrying oxygen. When oxygen levels drop, even simple tasks like walking up the stairs or getting out of bed can feel exhausting. A simple blood test to check hemoglobin levels can help determine if anemia, or something more serious, is the cause. Symptom number 3, persistent weakness and fatigue, feeling constantly drained, no matter how much rest you get. Extreme fatigue can be an early warning sign of blood cancer. Unlike normal tiredness, this kind of exhaustion is deep, persistent, and doesn't go away with sleep. Blood cancers interfere with the production of healthy red blood cells, which are responsible for carrying oxygen. When oxygen levels drop, even simple tasks like walking up the stairs or getting out of bed can feel exhausting. A simple blood test to check hemoglobin levels can help determine if anemia, or something more serious, is the cause. Listen to your body. Don't ignore what it's telling you. Symptom number 4, night sweats, waking up drenched in sweat, even when your room is cool, might be more than just an uncomfortable night. It could be an early warning sign of blood cancer. While occasional night sweats can happen due to stress, menopause, or infections, persistent and severe night sweats without a clear cause should raise concern. Blood cancers like leukemia and lymphoma can disrupt your body's ability to regulate temperature, causing excessive sweating, especially at night. Cancer cells interfere with immune system function, triggering inflammation that overheats the body. Unlike normal sweating, these night sweats can be severe enough to soak through clothes and sheets, without fever, exercise, or a warm room. A 2023 study published in the European Journal of Hematology found a strong connection between lymphoma, leukemia, and frequent night sweats, making this symptom worth paying attention to. If you're waking up drenched night after night with no clear reason, it's time to see a doctor. While not every case means cancer, when paired with other symptoms like fatigue, weight loss, or swollen lymph nodes, it's a red flag that should never be ignored. Symptom number 5, loss of appetite and nausea. Losing your appetite and feeling nauseous for no reason might not seem alarming at first, but these could be early signs of blood cancer. Cancers like leukemia, lymphoma, and multiple myeloma can alter how your body processes nutrients, leading to a sudden drop in appetite, feeling full quickly after eating just a small amount, or unexplained nausea. This happens because cancer cells disrupt digestion and metabolism, making it harder for the body to absorb nutrients. An enlarged spleen or liver, common in blood cancer patients, can also press against the stomach, making you feel full even after eating very little. A 2019 study published in Intestinal Research found a significant link between blood cancer, metabolic dysfunction, and appetite loss. Unexplained weight loss, especially when combined with other symptoms, should be taken seriously. If your appetite has disappeared for weeks, you feel nauseous for no reason, or you're losing weight without trying, it's time to get checked. Early detection saves lives. Symptom number 6, persistent itchy skin. Most people associate itchy skin with allergies, dry weather, or bug bites. But did you know that persistent, unexplained itching could be a sign of blood cancer? Blood cancers like leukemia and lymphoma can trigger an abnormal immune response, causing cancer cells to release inflammatory chemicals, like cytokines, into the bloodstream. These chemicals irritate the nerves in the skin, leading to severe, persistent itching that doesn't go away with moisturizers or antihistamines. What makes this type of itching different? It's intense, constant, and unexplained. It often gets worse at night or after a warm shower. It's usually accompanied by other symptoms like fatigue, night sweats, or weight loss. A 2019 study published in Dermatologic Therapy found that 30% of patients with Hodgkin's lymphoma experienced severe itching before their diagnosis. If your skin has been itching for weeks with no relief, don't ignore it. See a doctor, request a blood test, and rule out serious conditions. While itching alone doesn't mean cancer, when combined with other symptoms, it could be a critical warning sign. Symptom number 7, unexplained bruising and bleeding. If you notice frequent bruising from minor bumps or prolonged bleeding from small cuts, it could be a warning sign of blood cancer. One major red flag is sudden bruising in unusual places like the arms, legs, or back without injury. Some people also experience frequent nosebleeds, gum bleeding after brushing, or tiny red or purple dots, petechiae, on the skin, indicating small blood vessel leaks. A 2023 study published in BMC Cancer found a strong correlation between leukemia and abnormal bruising or bleeding. If you notice these symptoms, ask your doctor for a CBC, complete blood count, test to check for abnormal blood cell levels. Early detection is critical. Symptom number 8, fever or chills. Frequent fevers or chills without an obvious cause could indicate blood cancer. Leukemia and lymphoma weaken the immune system by interfering with healthy white blood cell production, making the body more vulnerable to infections. Unlike common illness-related fevers, these are often mild, below 101 degrees Fahrenheit or 38.3 degrees Celsius, persistent, and occur without typical flu-like symptoms. Many patients also experience chills and excessive sweating, even when they aren't sick. Cancerous cells can trigger an inflammatory response that disrupts temperature regulation. If you've had recurring low-grade fevers or chills for weeks, especially along with fatigue or bruising, consult a doctor. A CBC test can help detect blood abnormalities early. Symptom number 9, frequent infections. If you're constantly getting sick, it may signal a deeper issue, possibly blood cancer. The immune system depends on healthy white blood cells to fight infections, but blood cancers like leukemia, lymphoma, and multiple myeloma can reduce their number, leaving the body vulnerable. Signs to watch for include frequent colds, sinus infections, UTIs, pneumonia, slow-healing wounds, recurring sore throats, and skin infections. If you're struggling with persistent infections that don't respond well to treatment, a CBC test can help determine if your white blood cell levels are abnormal. Don't ignore a weakened immune system, it could be a sign of something serious. Symptom number 10, persistent cough and chest pain. A lingering cough or unexplained chest pain could be linked to blood cancer. Lymphoma and leukemia can cause swollen lymph nodes that press against the lungs or airways, leading to a persistent dry cough and discomfort in the chest. Unlike a cold or flu, this type of cough doesn't come with congestion, phlegm, or fever and can last for weeks. Some patients also experience chest tightness or pain due to enlarged lymph nodes near the lungs or cancer cells infiltrating lung tissue. If you've had a chronic cough or unexplained chest discomfort, a doctor may recommend a chest X-ray, CT scan, or blood tests to check for underlying issues. Blood cancer can develop quietly, with symptoms that seem minor at first. But recognizing them early can make all the difference. If you're experiencing persistent bruising, fevers, frequent infections, or unexplained cough and chest pain, don't wait, see a doctor and get tested. Early detection saves lives.